Hey guys, welcome back to the channel. This is Side Dental Vlogs, and today's video is very important because today I am going to tell you about one emergency, which is ingestion of sodium hypochlorite solution. So few days back one of my colleagues encountered this kind of problem. So it may happen accidentally while doing RCTs. Adding proper cotton, and if you are not applying rubber dam, then these kind of things may happen. But in all the cases, sometimes rubber dam application is not possible. So what we need to do is, first I will tell you the prevention, then I will tell you the cure. So for what we need to do is, we have to place 2 cotton rolls on both the sides of the tooth. Suppose you are doing the lower one, then both sides, buccal and lingual side, palatally the cotton nahi de sakta, you can hold a cotton on the where you are going to irrigate, and also give buccally, because agar aap buccally cotton roll nahi denge, then what will happen is the whatever liquid you are using to irrigate, it will flow from the sides. So tell your attender to hold the suction over the cotton and then irrigate. Okay, so that will reduce the amount of accidents. What is the first thing what you will see whenever sodium hypochlorite is ingested by the patient? Basically, it's a high quality bleaching agent. So what does it do? It causes irritation in the throat. Okay, suddenly the patient will gag. So what happens is, unknowingly we give local anesthesia. Sometimes the patient may ingest it inside. So immediately what we should do is, we should tell the patient to first gargle off. You add some chlorhexidine mouthwash in the glass which you use in your, and tell the patient to just gargle and give some drinking water. At least patient should drink half a liter of water, so that whatever concentrated amount which has gone inside will get diluted. Second thing, what to do of the throat irritation. So in order to give a kind of soothing feeling to the throat, we can give Muciane gel, which is a anesthetic, topical anesthetic gel, which will soothe the mucosa which is present in the throat. So Muciane gel always keep in your clinic. It's very cheap. The cost is around 80 to 90 rupees. Pink color solution. And whenever this kind of problem happens, you can give 2 spoons of Muciane gel, which will immediately soothe and provide anesthetic effect on the. And it also contains peppermint, so it will produce a cooling effect. Even after giving local anesthesia, some patients may have these kind of allergic reactions from methyl paraben as well. So when you are using these kind of you should always keep some emergency drugs in your clinic. So first protocol, what you should do, whenever the patient will send you any pic, so that I had uploaded on Instagram, so that patient started developing rashes. So the rashes jo develop hongi, it will get developed in the next 1 hour or 2 hours. So you are not present at the time. Suppose you did a RCT and in the evening time around 8 PM or 7 PM and you have gone home and you are enjoying, suddenly you get a call. Don't get panic. Just tell the patient to take a tablet of chlorpheniramine maleate, which is Evil 25 mg. If the Evil 25 is not available, which is available everywhere, so you can also tell the patient to check their medicine boxes and tell them if they are having some Montec-LC or levocetirizine. Montec-LC is montelukast and levocetirizine combination, or cetirizine 10 mg you can give to the patient. Another higher anti-allergic you can give to the patient, that is fexofenadine 180 mg, which is available as Elagra 180 mg in the market. But still, if the amount of allergic reaction is more, if the patient is getting a wheal and flare reaction means full reddishness in the thighs, forearms and inner aspect of the thighs, then we should use steroid, because it's an anti-inflammatory agent and Ramban medicine. So what steroids we can give to the patient? If the patient, you are about to write the steroids to the patient, सबसे पहले तो you have to ask the patient regarding their medical history, like if the patient is diabetic or not. If the patient is diabetic, then you have to check how much dose you are giving, because you cannot give 40 mg or 80 mg steroids to diabetic patients, and whether the diabetes is in control or not, because when you are going to give the steroids, so what will happen is the diabetes may increase as well as the BP. And also remember one thing, you should never give steroids to gastritis patients, because they will have more discomfort after that, because all the steroidal tablets, they produce a lot of gastritis. So when you are writing any kind of steroids to the patient, be careful first to write gas medicine, like anything like PAN-D40, PAN-40, Rabeprazole, anything you can give to the patient, whichever suits the patient. Though tell the patient to take 10 mg of Visolon 2 times a day. So Visolan 40 mg is a higher dose, 10 mg is a lesser dose. So even if you give 10 mg for 2 times a day for 3 days, then that won't cause much gastritis, and that won't lead to steroidal, all the side effects of steroids if you give it for a short time, for 2 days, 3 days, and that will drastically reduce all the wheal and flare and allergic reaction. Okay, for example, the patient gets the allergic reaction in the clinic itself, then you should have the Dexona injection with you, and you can give a Dexona 4 mg tablet. You should keep like a mometasone cream or betamethasone creams, so you can apply locally also. Sometimes what happens is what happened during my college day, one intern by mistake, she injected formalin while giving block, so got a huge swelling on the some mandibular region. And I remember when I was that time, I think I was in final year or I was an intern, I don't remember, long back, more than 10 years, 15 years pehle. So what happens is, so that formalin was kept in a LA bottle, and that maybe the intern or senior who was there, she thought that okay, this is local anesthesia, and she gave the block. So in that case, the patient was hospitalized first, and she was given IV drip. In the IV drip, she was given pan IV, she was given steroids. So don't let this situation happen in your clinic, because that was a hospital, it was managed very easily. But in your clinic, you have to be very careful. You have to label all the bottles where you are keeping your this thing. You should keep a separate place for the emergency medicines. You should keep a separate box for the local anesthesia. You should wisely, because at the time of crisis our mind stops working, right? So we have to immediately choose, okay, the allergic reaction has started now first. So Avil you can give very safely to any kind of patient. Okay, you give the Avil 25 mg, within an hour or so the inflammatory reaction will start subsiding. If you like this channel, please do subscribe and share this video as much as you can. You can also follow me on Instagram, Sai_Dental. Till then, namaskar. Love you all.